Hello everyone. Uh, in today's session, we, we will discuss about one of the most important instruments used in removal partial denture fabrication, that is the prosthodontic surveyor, also known as the dental surveyor. By the end of this video, you will understand what is a surveyor, what are its functions, and the clinical application. Now, what is exactly a surveyor? A prosthodontic surveyor is a mechanical instrument used for determining the relative parallelism of the tooth surface and other structures on the dental cast. It helps in designing the removable partial denture by identifying suitable paths of insertion, undercuts, and guiding planes. Uh, Before fabrication of a removable partial denture, the dentist must evaluate the cast carefully. Uh, why? Because surveying helps to determine the most favorable path of insertion and removal, and to locate and measure the undercuts, identify guiding planes, improve the retention and stability of the prosthesis, and eliminate undesirable tooth and tissue interferences. Now, parts of the dental surveyor are the base of the surveyor, that is a heavy platform that provides stability to the instrument. Then we have a vertical column, a rigid upright support attached to the base, and then a horizontal arm extending from the vertical column and supports the surveying arm. Then we have the surveying arm that moves vertically and carries the analyzing tool. Then we have the surveying table or the cast holder that holds the dental cast and can be tilted in different directions. And surveying tool, uh, there are four surveying tools that are used. First is the analyzing rod, then we have the carbon marker, undercut gauge, and wax trimmer. Um, the main function of the surveyor is to determine the path of insertion. The surveyor helps select the most suitable direction for denture placement, and then detection of undercuts. It defines retentive areas necessary for class placement. Then of course we have delineation of height of contour, that is to mark the greatest prominence of tooth surfaces. And then evaluation of guiding planes, it assesses parallel surfaces that guide insertion and removal. And then the mouth preparation planning, the surveyor assists in determining accessory enamel modification. Uh, the stepwise procedure of surveying is: first step is to mount the diagnostic cast on the surveying table, then use the analyzing rod to examine the tooth surfaces till the cast until an ideal path of incision is achieved, and then mark the survey line using a carbon marker, measure the undercuts with appropriate undercut gauges, and finalize the removal partial denture design. The advantages of using a surveyor include improved denture retention, better stability and support, accurate clasp design, reduced insertion and removal difficulties, enhanced patient's comfort. But in spite of this, dental survey is not without limitation. Uh, the sur- it is most important limitation is that it analyzes cast rather than the oral cavity directly. So operator skill affects accuracy, and surveying alone cannot replace clinical judgment. Uh, One of the important questions that is asked regarding this survey is, what is a dental surveyor? So, as we have already discussed, it is a mechanical instrument used to determine the relative parallelism of surfaces on the dental cast. Uh, what is the most commonly used surveyor? The nail surveyor is most commonly used. Which instrument is used to locate the undercuts, the undercut gauges, and what is a survey line, a line marking the height of the contour of tooth. To summarize, the prosthodontic surveyor is an exponential instrument enable partial denture design. It helps determine the path of insertion, locate undercuts, identify guide planes, and improve overall processes success. Hopefully, the information provided in this video was of use to you. Uh,